Well, let me tell you a story about one of my patients. His name was Mario, and he owned the best restaurant in Westport, Connecticut, aptly named Mario's. Now, when Mario came to see me, it was back in the 90s, and I was just in practice. I probably was in practice a few years, and he came to see me for a full mouth rehabilitation. And at the time, I was just starting in practice. I was in a lot of debt. I did not have that many patients, and seeing somebody like Mario come into my office was a big deal. Because Mario, being the proprietor of the most expensive and the most popular restaurant in Westport, which was right by the train station, it was back in the 60s and 70s. He sold more liquor in that restaurant than any other restaurant in the entire state of Connecticut. Because people would come off the train, they'd be drinking on the train, then they'd go to see Mario's, and he'd serve great martinis, and then they would drive home. But you could drink and drive back in the 60s because the cops would just pull you over and go, "Oh, I'm sorry, Mr. Jones, you're drinking a little too much. Let me drive you home and let me call your wife." And Mario, selling more liquor than any other restaurant in the state of Connecticut, was busy. And he was prominent. And he knew everybody. And he had a photographic memory for names. So he must have known 5,000, 10,000 people. So having him as a patient was a big deal. So he came into my office one day, and I examined him, and I told him what he needed. He needed a full mouth rehabilitation. We were going to do his lower jaw first, take out his teeth, place some implants immediately, and then restored him about 4 months later. Well, he came back for a second consultation. And this time, when he came for the second consultation, he came with his girlfriend. He'd been married for 45 years, and his wife had recently passed away. And his girlfriend was 30 years younger than him. So I'm thinking to myself, this girlfriend, 30 years younger, she's probably with Mario for his money because didn't have any children, and he lived very conservatively, and he had the most successful restaurant in the state of Connecticut. So we looked at each other, me and the girlfriend, and we immediately disliked each other. There was this tension. I looked at her as someone who was going to get in my way between treating Mario. And she probably looked at me as some young punk, which I was, because I was only in my 30s at the time. And so I presented the treatment to Mario, and she looked at me and didn't talk much, but there was that tension. And you can always feel that tension when you see somebody. It's called a blink. Malcolm Gladwell talks about it. Within 2 or 3 seconds, you know if somebody likes you or doesn't like you. And we obviously didn't like each other. Well, Mario said to me, he goes, "I'm going to think about it." Now, this is his second consultation at my office, and now he's telling me he's going to think about it. So if someone has to think about it, what does that mean? It means they're not coming back. So I never thought I'd see Mario again. And for 2 reasons I was upset. Number one, I really wanted to treat him because he was well known, and I thought he would be the source of new patients for the practice. And second, it was a big case, and I was in a lot of debt, and I needed to do business back then. Today, at this point in my career, I don't have that, those same feelings. But I really tried very hard at that point in my career never to seem like I was hungry for the business, that it was really that important for me. I always just wanted to do the best for my patients. So Mario left with his girlfriend, who I didn't like, who I assumed didn't like me. And that was the end of it. 2 weeks later, Mario calls me. Third consultation. He comes in and he says, "I decided that I'd like to go through treatment." I said, "Okay, great." And he goes, "How much is it going to be?" Now, the treatment was to extract his lower teeth and to place 5 implants and then to expose them 3 months later and then to restore them. My fee at the time was $9,000, which was a lot of money to me at that time. It's still a lot of money. And so I said, "It's $9,000. He goes, "Okay, I'd like to do the treatment." He goes, "Is it okay if I pay you half now?" I said, "Sure." So he takes out a checkbook, because this is back in the 90s, and he starts to write out a check. Now, half of $9,000 is $4,500. So I expect him to write a check for $4,500. And I said to him, "You don't have to pay me now." So I didn't want it to seem like I was eager for his money or to do business with him, so I said, "It's okay to pay me later," which it was, and it really didn't matter. So he starts to write the check for $4,500, and I look down, and he writes it for $9,000. Now, he just told me he was going to pay me half at $4,500, but he's writing for $9,000, and he hands me the check. And at that point in time, I said, "Mario," this to myself I'm speaking, I said, "Mario is going to be looking at me to see if I'm very eager to get that money. He's going to look at me to see if I have what I call cash register eyes. Are you looking at him like you want his money? Are you looking at him that the money's more important than the value that you give to him as a doctor?" I said, "Mario, you don't have to pay me $9,000 now." He goes, "I'm going to, because I'm comfortable with you, and I want to go through a treatment. So I knew Mario was very smart when it comes to people. He had great people skills, and I knew he was 80 something at the time, and I was in my 30s. So he had a lot more experience than I did dealing with people. And I knew that. Even though I was young and arrogant, I still knew that he knew more than I did about this situation. So I said to Mario, I said, I was surprised that you came back. I said, I want to ask you a question. He goes, sure. He was a really nice, open guy. He goes, what's your question? I go, I'm surprised that you're back because I didn't think you'd come back because of your girlfriend. He goes, what do you mean? Now, I know he knew that I knew what I meant, but he was just playing with me a little bit. I said, she didn't like me. He goes, well, you didn't like her either. I said, I know. That was probably pretty obvious for the two of us. He goes, but she did respect you. I go, what do you mean? She goes, when we left your office that day, she said to me, she goes, Mario, I had never seen anybody wear sneakers so white. The importance of wearing white sneakers was lost on me that day. I was just talking to Mario and his girlfriend. But I always wear really clean white sneakers. Matter of fact, I have 3 pairs of white sneakers in the 3rd floor of my office. And then about every 6 months, I look down at my sneakers, and when they're getting a little dirty, I toss them out or bring them home to wear just to work around the yard, and I put on a new pair of white sneakers. And everybody in our office does as well. It's just one of the many little things that we do in our practice to set ourselves apart. So next time you go into a dental office or a medical office or a restaurant or any place, look at what they're wearing on their feet. It's one of many things that they're probably doing right if they're running a good business. Because people who run a good business know the importance of looking good. And one of the last things people look at are their shoes. When I have an interview or do an interview with a new employee, I look them up and down, or even with a patient, and I look at 6 things: hair, eyes, teeth, clothes, fingernails, and what are they wearing on their feet. So if you don't have a good pair of white sneakers in your office, get them and buy them for your whole team. And it's just part of our protocol. Have a good day, everybody. Remember, wear white sneakers. You'll be the gift to your patients.